My name is Aman Chauhan. I'm a medical oncologist. I lead our neuroendocrine oncology program at the University of Miami. And I also co-direct our theranostics or radiopharmaceutical drug development program at Sylvester Comprehensive Cancer Care Center. I have been working with Crinetics now for a few years, spanning back to my days at the University of Kentucky about 5 years back. And our paths crossed when we were investigating a very novel, first in its class drug called Paltusotine, which is seeming to be very promising for our neuroendocrine cancer patients with carcinoid syndrome. So that's how I got to know about Crinetics, and it's been a great association moving from a phase two now to an soon to be launched phase three international clinical trial. So neuroendocrine cancer is not a single disease. It's a multitude or spectrum of diseases. Comes in different types, subtypes, and manifestations. For example, low-grade, well-differentiated neuroendocrine tumors, the kind what Steve Jobs had, the gentleman who made iPhone for us. He had a neuroendocrine tumor of pancreas. And on the other end of spectrum could be a very high grade, very aggressive, rapidly fatal cancer or called neuroendocrine carcinoma. The another way to classify these neuroendocrine tumors is based on their ability to secrete a hormone like serotonin that gives rise to certain clinical symptoms, carcinoid syndrome being one of the commonest neuroendocrine tumor functional syndrome. What happens when neuroendocrine tumors, like an intestinal neuroendocrine tumor with metastatic disease to liver or some lung nets, they can secrete this hormone called serotonin and give patients bad diarrhea or flushing, among many other symptoms. And these symptoms, although might seem very trivial to people who don't deal with neuroendocrine oncology, but they are very problematic and significantly affect the quality of life of neuroendocrine cancer patients. And there's tremendous amount of data regarding carcinoid syndrome, how it affect, including longevity of their life, because it can cause carcinoma, heart disease, among many other things. But certainly, quality of life impacting diarrhea and flushing are very problematic in a subset of neuroendocrine tumor patients. Regarding the management of these functional neuroendocrine tumors, where a neuroendocrine tumor is secreting a hormone, we have drugs called somatostatin analog, and currently there are lanreotide and sandostatin. Those are currently in use in United States and globally as well. The problem is both these very effective drugs are injectable. That means patient needs to get pretty deep injection, either deep intramuscular subcutaneous once a month to get this drug in their system. And then this agent tries to control the secretion of this hormone for the rest of the month, which in turn helps control the flushing and diarrhea and these carcinoid syndrome related symptom in neuroendocrine tumor patients. Now, during my interaction with neuroendocrine cancer patient, there are patients who don't like an injectable form of the drug, and it's a literal pain in butt to get a deep injection once a month in your buttocks. So there was a big clamor in neuroendocrine oncology community for the longest time to find an oral alternative, a pill that patient can take at the comfort of their home, which does the same thing. And I'm glad that the scientists at Crinetics really, made that happen. And this class of drug called paltusotine, which is an oral somatostatin receptor analog, is now FDA approved for acromegaly. So they first started working with this agent in acromegaly or growth hormone disease, and it made sense to kind of roll that over to neuroendocrine cancer patients. So this year we have good showing at our NANETS symposium in Austin, which is the premier neuroendocrine cancer professional society in North America. And one of the studies that was presented as a poster was a trial in progress where we are testing paltusotine, that's the oral somatostatin receptor analog, in carcinoid syndrome patient. And it's a randomized phase 3 study, international, multi-center, placebo-controlled, and blinded. So that's the purest and the best form of scientific studies to validate your scientific hypothesis. In this particular study, patients who have carcinoid syndrome, essentially flushing and diarrhea, will be randomized between effective drug, that is a pill, oral paltusotine, the patient takes once a day, versus placebo. And since it's a double-blinded study, we would not know who's getting what. This is a study where patients will be treated for 16 weeks. And the primary endpoint of assessment of change in the flushing frequency will be assessed at week 12. So it's a short and sweet study where patients who are suffering from carcinoid syndrome will have now opportunity to be enrolled in a trial where they have access to oral somatostatin receptor analog. And the best part is the patients who do unfortunately get randomized to placebo and don't benefit from it will have opportunity to eventually roll over once they come off from the active treatment period into open label extension. They get to be on oral paltusotine. So in a way, it's a win-win for everybody involved. The study is very well designed and builds on the success of the previous study that was a phase 2 study, and that was presented last year at NANETS. That was also an international study and multi-center where we tested two different doses of paltusotine in carcinoid syndrome patients. These are the patients who had more than 4 bowel movements a day or flushing at least 2 episodes a day or more. And what we found in that study that not only paltusotine was safe, but had significant efficacy in reducing the carcinoid syndrome symptoms. So what we learned from that international phase 2 study is how to now design a more definitive phase 3 study, which, if positive, may lead to us having another standard of care drug that we can use in managing carcinoid syndrome in neuroendocrine tumor patients. There's a lot of excitement in the field. I come across patients who can't wait to be part of the study and have access to this class of drug, which otherwise currently is only available under research protocols. So the immediate next step would be for many sites to activate the protocol. This is a rare disease, and within that, we are looking at a rarer subset of neuroendocrine tumors with carcinoid syndrome symptoms. So we also want to make sure that the study completes its enrollment before anticipated timelines, and that will take a concerted effort from US, Latin American countries, as well as European countries. So I'm very happy to know that Crinetics is throwing a wide net to capture as many high volume neuroendocrine tumor sites as possible so we can wrap up the study in a timely fashion.